Thank you very much, and good morning, colleagues. It's indeed a pleasure to have with us some of our past residents who have trained with us at Ocean Road and others from elsewhere. So on behalf of myself and Ocean Road, I wish to extend a very warm welcome to all of you. And for those of you who don't have time even to visit Dar es Salaam, you're welcome to visit Ocean Road. Do come. It'll be lovely to have you. All right, so I've been asked to talk about our context and our experience in training oncologists through our Tanzania Oncology Program. A quick bio: I serve as a clinical oncologist at Ocean Road Cancer Institute as the head of the unit for research and training, but I'm also the head of department at the Department of Clinical Oncology at Muhimbili University of Health and Allied Sciences. My special interest is in breast cancer, palliative care, survivorship, and of course, training and medical education. So what I'd like to share in this talk with all of you is some insights. When this program was started, there were some choices that were made regarding training oncologists in Tanzania, and what were the possible reasons and choices that were made which could lead us to have some insights. And then a little bit about our experience and the impact of our programs, and of course, looking ahead. When we talk about training, we have to make certain choices. The first choice, of course, is whether to train or not. And I think the answer there is obvious. We know that the number of cancer cases is on the rise exponentially in Africa. We just heard it's a tsunami. There's a severe shortage of trained oncology personnel. A paper in 2018 said that there's about one oncologist per 1,000 incident cancers in 25 countries in Africa. And as you can see from the map, there's a severe spectrum and range of differences in terms of resources as well as facility. So the obvious answer to this is yes, we do need to train. But the next question is how? We have to make choices regarding the curriculum that we use for training. Number one, do we use existing curriculum? There are many training programs around the world, many of them Western, and how are we going to use them or adapt them to our context? What kind of curricula should we have? Should we have harmonized curricula across the region, or should they be local or tailored? Curriculas are complex. There's different components and approaches that we need to know, and there's so much more to it than just the content. If we look at the work that has been done on medical curricula, we find that there are different stages of how curricula are implemented. You can have an official or a planned or an intended curriculum that is actually a document that was submitted to the TCU, approved, and is now as a document in the university. But that may vary significantly from what is actually operational or implemented in the classroom or on the bedside of the patient. And that also may differ significantly from what the students experience, how they perceive, and what they learn. And finally, there's what we call the hidden curriculum. The hidden curriculum is a set of soft skills, cultures, professionalism that a student will inculcate from the mentorship and the apprenticeship that they have with their with their mentors. And all of this will work towards creating the future oncology workforce. In addition to that, there's the educational content, there's the teaching and learning strategies, the methodologies that we use, how we assess and evaluate these students, and how we plan to work on our curricula and to renew them and to update them. There's been a lot of talk about harmonization of curricula. We have at the Muhimbili University a program that is trying to harmonize undergraduate curricula across the region, across Tanzania and East African countries. And there has been a concern about looking at postgraduate curricula as well, especially in oncology. However, there is a bit of caution that we need to keep in mind, because there's always a need to keep a curriculum in context. A study that was, a paper that was written in 2020 discusses taking or importing curricula from a different context and bringing it into your local culture, and talks about the dangers of this, saying that sometimes it could actually do more harm than good. So this is also a choice we need to make when we are planning our training. The third issue that can come up in planning your training could be looking at the duration of training versus the resources. Our program is a 3-year postgraduate program, which is way, way shorter than what the training is offered in many Western countries. But looking at our context, how feasible is it to have a 5-year program versus a 3-year training program? Keeping in mind that many of these training programs are actually supported financially by the Ministry of Health, And these specialists in training who are going to be in the program are actually going to be out of the workforce during the training period. All this needs to be kept in mind. And finally, looking at the training needs. In the West, we have oncology curricula, which may focus only on medical oncology or on radiation oncology. But in our context, we probably do not have the luxury for that choice. Often our candidates and our postgraduate students need to develop skills and competencies in multiple areas: planning treatment, administering and providing chemotherapy, radiation therapy, preventive care, preventive and screening practices, palliative care, and they're also required to teach and to conduct research. And therefore, our programs often need to look at an effective way of providing all these multiple competencies and skills so that we can address the needs of our local context in the easiest and the most resourceful way. And this is reflecting to Dr. Fidel's talk about choosing wisely. So the top challenges that can come across curricula, which has been reported by this paper, are inter-country variation, implementation of curricula, having multiple stakeholders who are interested in the curricula, shortages of health professionals, both on the ground and in teaching, as well as resource constraints. The idea is that medical education must become both the vehicle for reform and the object of reform. So it should be influential in making changes as well as being change itself. Now let us come to our experience in Tanzania. Our postgraduate program in clinical oncology in Tanzania was started in the year 2010. It was a 3-year curriculum. It is offered by the Muhimbili University of Health and Allied Sciences, which is MOHAS, and Ocean Road Cancer Institute is the clinical attachment site for this training program. The Department of Clinical Oncology of MOHAS is also actually based at Ocean Road Cancer Institute. When this program was initially envisioned, it was developed locally, but with support from the International Atomic Energy Agency. And there was a lot of leaning towards training in radiation therapy because that is where the skills were significantly lacking. Currently, we have 73 graduates from this program and 35 current students from 8 countries who are with us. And we have had significant local and regional impact through this training. Looking at the numbers across the years, if you look at this graph, from the year 2010 all the way till 2014, you can see only Tanzanians were candidates in this program. In 2015, we had our first intake of foreign candidates around East Africa and Central Africa. And as the years grow, we've seen significantly Rwanda and Kenya become important members in terms of our candidates. But we also had students from Malawi, from Ethiopia, from the DRC, from the Comoros, etc. So while Tanzania features largely, 68% of our candidates are from Tanzania, we have significant numbers from Kenya and from elsewhere. What has been the impact of this program? If we look at Ocean Road itself, the impact has been massive. Beginning with 4 oncologists in the year 2010, we currently have 23 practicing oncologists at the Institute. And this has allowed us to significantly expand and improve our services for cancer care. Our firms are now subspecialized. We used to have doctors treating everything, oncologists treating all the cancers, but right now we are subspecialized. Our radiotherapy techniques have improved, moving slowly from 2D to 3D and now to IMRT and moving forward as well. Reduced waiting time for our patients, improved opportunities for research. We have created an academic environment, so even our non-academic clinical staff now participate in seminars, in trainings, are motivated to perform research, etc. And there is a very generally positive and, shall we say, leaning towards academics, leaning towards improvement of practice environment that has come up as a result of having the program. Regionally, majority of the alumni of our program are practicing oncologists. Many of them are both radiation and medical oncologists. Some practice only medical oncology, largely due to a lack of facilities in terms of radiation therapy. Many are holding academic positions in universities and teaching institutes. Many are actively engaged in research. Many are in administrative and leadership roles in their countries and regions. And whenever we have scientific conferences regionally or we have societies, there's a strong regional presence of our alumni in these programs. Let me share a few insights and a few examples from some of the countries that have been impacted by this program. Those of you who have been at Ocean Road will recognize Dr. Sinta. He is the only Ethiopian candidate that we have who completed this program successfully, a brilliant oncologist, making a big difference in his country, despite the many civil and political challenges that they have. Mombasa, Kenya, Coast General Hospital started their oncology services. You may recognize Dr. Fatma here, also one of our residents, completed in 2019. And interestingly, just last year, they were working with the IAEA to begin brachytherapy services. And around October, they had their first brachytherapy patient being treated. Zanzibar. Before the program, before 2017, we had no oncologists in Zanzibar, and all the patients from Zanzibar had to be flown in or had to take the boat to come to Dar es Salaam, even for simple things like consultation, chemotherapy, etc. Once the two trained oncologists moved to Zanzibar and started their services at Nazima Hospital, our oncology department was started over there, and we had significant improvements in terms of reducing the number of patients who would have to be brought to Dar es Salaam because they started consulting, they began chemotherapy services. They currently treat about 50 patients with chemotherapy every week. They have cancer screening. There's reduced economic burden both on the families as well as on the government. And more importantly, there's a lot of awareness about cancer. Some of these pictures from Nazimoja showing the staff actively engaged in treating, in giving health education, and that is their cancer team. So how does it work? How do we make the curriculum work in bringing out this care and this effect on the patients? There are ways in which we can adapt our curricula to meet our local needs. For example, the clinical oncology curriculum has both radiation oncology and medical oncology components. We try to bring in training and exposure to palliative care. We have rotations in pediatric oncology, so our oncologists not only learn to treat adult cancers, but also get exposure in managing pediatric cancers, and they can support pediatric oncology as well. Adapting the curricula, transitioning from two-dimensional to three-dimensional radiation therapy, this started way back in 2018 and has been moving forward through training, supervision, research, collaborative programs through supporting institutions, both international and from other countries, and trying to create context relevance. For example, the issue of ethics. When we teach ethics and professionalism, the Western ethical model is often very irrelevant in our setting. So we need to adapt it to what is required and what will work with our culture. An important impact of this program and of our work has been creating guidelines and protocols. Right now we have what we call the NCCN harmonized guidelines for the sub-Saharan African context. Tanzania has created its own cancer treatment guidelines through the support of international organizations. All right, and in these pictures you can see the launching of the guidelines by the Minister of Health, which has made a significant impact so that we now have our harmonized treatment protocols across the country. But looking ahead, we can't stop there. There are many, many more needs. And as we keep growing, as the numbers increase, as our resources improve and our infrastructure increases, we realize that our programs and our education needs to grow as well. There was a need to translate this care to reach our patients. We had very well-trained oncologists, but we realized that the practice and the training was not trickling down to our patients. 2 years ago, we started our MSc Oncology Nursing program, and last year in December, we had our first group of oncology nurses graduating. A good number of them actually are back at Ocean Road, now translating this care to our patients, and they are now taking up the task of training other students in the same program. There is a need for physics support. As our radiation therapy techniques improve and become more complex, there is a need for more medical physicists, and we are working with University of Dar es Salaam in developing a curriculum for having a medical physics program in the region. There may be a need now to start specializing in medical oncology as a specialty itself, rather than having only a clinical oncology curriculum, and that is being looked into. And finally, there is a need to look at our training itself. How effective? What is the quality? What is the impact of this training? Is there a need to review the curriculum, evaluation, assessment, and most importantly, skills? It's a picture of our nursing graduates. Some of them actually are in here in the audience, those who graduated in December. And therefore, to end, when we're training the oncology profession, there are important choices that we need to be made in educating them, in choosing curricula. And some of these choices will need to focus on feasibility of resources and relevance to the local context. There will always be challenges, but there are many, many opportunities to share resources across the region, across countries, and internationally. There will always be opportunity to learn and to collaborate. One thing that we have learned is flexibility is important. If we are rigid with our plans and our visions, we may not be able to move forward. But when we're flexible and open to sharing and learning, things move very fast. There's always a lot more that we can do, and we can make a difference one resident at a time. Thank you for your attention.